For this video, we'll be discussing the use of mirror boxes for pain therapy. We'll be looking at exercise progressions involving the hand. So we'll start with simple exercises involving the unaffected hand, and then we'll move forward to more advanced exercises involving both hands before finally ending up actually manipulating objects. It's important to remember when doing this type of therapy that though you may experience some discomfort, it shouldn't increase pain at all. And finally, though the exercises you'll see here are only on screen for a few moments, it's expected that you'll do these exercises for longer, namely, hopefully a few minutes at least. So with that in mind, let's get started on mirror box therapy. So the first exercise you'll do is simply observing your hand. Your affected hand is in the box, your unaffected hand is outside the box. And you're just looking at it and in essence trying to get your brain to accept the fact that the hand that sees in the mirror is actually your affected hand. Next, we'll be going through several progressions. In these progressions, the hand outside the box will be moving and the hand inside the box is going to remain stationary. So here we have the hand being rotated while the hand inside the box, the affected hand, is stationary. Next, you're going to touch each finger to your thumb. Once again, the hand inside the box is not doing anything. The hand outside the box is doing all of the work. From here we can go to making a fist. I want you to hold it strongly for several seconds before releasing it. And it's important not to make that fist with the hand inside the box. And here we're simply going through more progressions of moving the hand and flexing it and extending it through its full range of motion. Now we're going to repeat most of those exercises we have just done, except now both hands are going to be participating. That means the right and the left hand will both be doing the motion. So here, the patient is touching each finger to their thumb. They're also doing that with their left hand, although not as forcefully. So you want to forcefully touch your fingers to your thumb on the right hand, but on the left hand it should be gently so as not to cause any increase in pain. Next we'll be making a fist again. The right hand should be making a fairly strong fist, while the left hand, the one that's inside the box, should just be opening and closing gently so as not to cause any increase in pain. For this last exercise, we'll be rotating the hand just as we did before, but just as with all these other progressions, now we're going to be doing it with both hands. So the hand inside the box and outside the box are both rotating, as you can see. For our last set of exercises, we're going to be progressing to holding and manipulating an object in both hands. Here we're using an expo marker, but it could really be anything you want. So to start out, we're just moving that around in our hands, and that's in the left and right hand. In this next set you can see all you have to do is simply squeeze and then release, squeeze and release. The overall idea is you can do as many different things you want with as many different types of objects as you want. But this is the last step of our progression. To recap, before we end, we want to make sure that 1, your exercises don't increase your pain markedly. 2, remember you want to perform these exercises for 1 to 2 minutes initially and then increase from there. Remember to always, you want to start with the unaffected hand first, outside the box, and then we can progress to adding the other hand together. And finally, I didn't mention this before, we want to try to make both hands as visually similar as possible. So if you have a tattoo on one hand and on the other, try to cover that up or do something, take off jewelry on one hand if you don't have it on the other, anything that makes them as similar as possible so that the feeling, the weight, and the movement of each hand is the same. And that's all we have for mirror box pain therapy.